Can isolated diastolic hypertension be reversed? Have you ever wondered if isolated diastolic hypertension can actually be reversed? This condition, where the lower number in a blood pressure reading is elevated while the upper number remains normal, is quite interesting. Specifically, isolated diastolic hypertension is defined as having a diastolic blood pressure of 80 to 90 millimeters of mercury or higher, depending on the guidelines, while the systolic pressure stays below 130 or 140 millimeters of mercury. This form of hypertension is more commonly found in younger adults. Factors contributing to it include increased body mass index, higher glucose levels, alcohol consumption, and elevated triglycerides. So, can it be reversed? The good news is that it often can be, especially through lifestyle changes. Making healthier choices can significantly impact your blood pressure. For instance, adopting a diet low in salt and saturated fats is a great start. Regular physical activity is also essential. Aim for at least 30 minutes of moderate exercise most days of the week. Maintaining a healthy weight can further help manage your blood pressure. Limiting alcohol intake and finding effective ways to manage stress are also beneficial. These lifestyle modifications can effectively lower diastolic blood pressure and reduce the risk of cardiovascular issues. However, if these changes are not enough, healthcare providers may suggest medication tailored to your specific health needs. It is important to understand that isolated diastolic hypertension is linked to an increased risk of cardiovascular complications, such as heart attack and stroke. However, the strength of this link is not as clear as it is for other forms of hypertension. Treatment approaches can vary based on age and overall cardiovascular risk. For younger individuals with isolated diastolic hypertension, immediate medication may not be necessary. Older adults or those with additional risk factors might benefit from a more aggressive treatment plan. In many cases, isolated diastolic hypertension can be reversed or controlled through targeted lifestyle changes and, when needed, medical treatment. Early detection and management are key to preventing long-term complications associated with elevated diastolic blood pressure. So, if you or someone you know is dealing with this condition, remember that positive changes can lead to better health outcomes.